Aloha, my name is Sherryl Brown and I am a Master's of Social Work student at Hawaii Pacific University. Thank you for watching my 2023 Capstone Symposium project. My research proposal is, does racism hinder how medical treatment is given to minorities? Today, I will present the background of my research topic, the research question, the methods used, the results, discussion of the findings, and implications. Now a little background. Even though explicit biases in the American healthcare system have declined, why do healthcare providers still hold negative explicit and implicit biases against marginalized racial and ethnic minority populations? That includes Black Americans, First Americans, and those of Hispanic and Latino descent. Why do Black Americans, Hispanic Americans, and First Americans have higher infant mortality rates than white and Asian Americans? And why are Black women 3 times more likely to die from a pregnancy-related cause than white women? There have been many accounts where medical providers dismiss the minorities' personal accounts of medical history. One could argue that these groups are not viewed as desirable patients, and healthcare providers deliver substantial care to persons of low socioeconomic status. This equates to poorer health outcomes among certain populations, specifically African Americans, which brings us to the research question. For the research question, I specifically wanted to know if one's ethnicity plays a part in the decision-making process of medical providers. I wanted to know if my ethnic background factors into how I am medically treated, which led to the research question, does racism hinder how medical treatment is given to minorities? Now for the methods section. Data collection came from open access peer-reviewed published articles held by Hawaii Pacific University, focusing on the research question. The articles must have been published in English with a date range between 2013 and 2023. Research articles that reported results of racial ethnic discrimination, patient or provider perceptions of race or ethnicity-based discriminations within healthcare settings. Listed are also the keywords used in the search. Now for the results. The purpose of the systematic literature review was to examine existing literature on how biases in the medical field affect patient outcomes. A total of 2,835 articles were located using the HPU database. The researcher then expanded the database to include EBSCO, Gale, and Taylor and Francis, where an additional 80,804 articles were located. Duplicates removed were 1,664, which meant 81,975 articles were eligible for the criteria. Of that, 14 articles were included in the systematic literature review. The results of this systematic literature review built on existing evidence that structural racism within the healthcare system directly affected how medical treatment is given to minorities, and these biases do interfere with how minorities are treated. From the literature, 3 common themes emerged. Biases within the structural organization, implicit biases towards minorities, and false beliefs about minority women. The research implied that racial assumptions are not just limited to personal beliefs, but racially biased beliefs are supported within the fabric of institutions and eventually become the infrastructure of those institutions. The literature noted that racism works systematically and on an institutional level, and that society has developed institutions in ways that will not allow people of color representation in medicine. The published research also found that providers frequently use implicit and explicit biases when treating minority patients. Healthcare providers have used stereotypes as a frame of reference when treating African American patients. Providers' assumptions about minority patients not having health insurance, using illicit drugs, and faking illnesses or symptoms, or ignorance about their own health condition can compromise the level of care given. As noted in a majority of the studies, beliefs about women who are more affected by non-visible, poorly understood, underfunded, and stigmatized chronic illnesses such as depression, autoimmune diseases, including fibromyalgia, and recently long COVID. The authors go on to note that a provider who dismisses a Black female patient's concerns about pain may be drawing upon false beliefs about biological differences across racial groups. Implications of medical biases do not stay with the healthcare provider. It is extended to the patients as the rationale behind actions used as the basis for decision making. The implications for these decisions stem from cultural stereotypes, which continue to perpetuate healthcare inequalities, which creates gaps in medical knowledge for minority communities. Healthcare providers cannot improve the quality of their care without also identifying and reducing disparities in the care that their minority patients receive. In conclusion, the research displayed in the systematic literature review confirmed that patients of different ethnicities and gender frequently receive different levels of medical care, and health disparities are prominent among minorities. There is a need for additional action to heighten awareness about negative biases towards minority patients, in addition to follow-up research to monitor these outcomes. Future studies should also expand on how social workers in the medical field advocate against medical biases because all patients deserve the same level of care. Thank you for viewing my 2023 capstone presentation. Mahalo.